Hi, my name is Ruth Masterson-Krieber, and I'm an assistant professor of healthcare policy and research in the Division of Health Informatics at Weill Cornell Medicine. And I'd like to share with you a little bit about one project that I've been working on around developing a mobile health application to support heart failure symptom monitoring. As you might be aware, heart failure affects more than 6.5 million Americans and over 26 million people worldwide. It's also very costly. It's estimated to cost over $39 billion annually, and this is primarily due to the burden of inpatient hospitalizations, of which 90% are estimated to be preventable. One of the driving reasons for people to get hospitalized is due to ineffective symptom monitoring and management. As one person said, we do a great job of tuning people up in the hospital, but we honestly have no idea who's coming back and when. This is from an attending physician. And there's really right now a major gap between the care that we're providing our patients in the hospital and then at home. And what we'd like to be able to do is more closely monitor patients in this interclinical space, that space outside of the hospital and the outpatient clinics, using different types of mobile technologies, including smartphones. These really could be part of the solution for closing that gap between the hospital and home. So the research question that I've been pursuing is how we can use mobile health technology to facilitate the identification of symptoms and symptom monitoring among patients with heart failure. So what we did was we went forward with developing a mobile health application to support patients with symptom recognition, monitoring, and communication with providers. To start this work, we did a review of the literature on the topic and then a comprehensive review of commercially available mobile health applications for symptom monitoring and management to be able to identify which apps had already been developed for patients with heart failure and then to be able to characterize their features. So in this process, we reviewed over 3,000 smartphone applications in the Apple iTunes Store, Android, Google Play, and Amazon App Store. After going through very specific eligibility criteria, inclusion and exclusion criteria, we included a total of 34 applications. And then we reviewed them with the Mobile Application Rating Scale, IMS Functionality Score, and Heart Failure Society of America Non-Pharmaceutical Guidelines. I'm just going to show you some of the highlights from this review. What was most important was that overall, these applications were in very early stages of development, and they really offered patients few features to truly help with their symptom monitoring and management. As you can see, most focused on recording, collecting, and displaying information, but few offered other features. So we developed the My Symptoms web app as an external wraparound to the Allscripts electronic health record so that we could input the patient's medical record number and their health information would populate the tool. Based on the findings from surveys, interviews, and fieldwork, we selected validated questionnaires that measured physical and psychological symptoms that patients and providers reported as being most important to the management of heart failure. To measure acute physical symptoms, we chose the Heart Failure Somatic Perception Scale. And then to measure non-cardiac symptoms, including psychological symptoms, we use 10 standardized patient-reported outcome measurement information system, or PROMIS short-form questionnaires developed by NIH. We chose the PROMIS questionnaires because they're freely available and not disease-specific, thus they capture non-cardiac specific symptoms that are common across multiple chronic conditions. All the PROMIS questionnaires also have Spanish versions, which have been linguistically validated and are freely available. To design the application, we went through a series of design steps and studies with over 200 patients with heart failure. I'm primarily going to focus on an in-field evaluation that we did with 168 patients. However, details about the design process have been recently published in this paper here in Applied Clinical Informatics. We had a very simple flow for the study. Patients would input their medical record number into the tool, and then they would verify their information. Once again, that was pulling data from Allscripts to populate the tool. Then patients would complete My Symptoms. Here's a couple screenshots of a patient answering a question related to anxiety and another one here. The icons were added They had been comprehension tested in the community in both English and Spanish. And they were really important because many of the patients that we had very low health literacy, as well as low English or Spanish literacy. Patients would then view summary visualizations of their symptoms. And this is an example of a type of summary visualization that patients would see. They then could use these visualizations in their communication with their healthcare providers. We evaluated whether patients preferred small cards or large card formats. And we're still in the process right now of updating many of these visualizations. They would then return the iPad to the reception and once again have printouts of each of the summary visualizations, which also rank ordered their symptoms to be able to facilitate their patient-provider communication around their symptom experience. We did this field evaluation with 168 patients. This study was completed in the Washington Heights neighborhood of New York City, which is predominantly Latino and socioeconomically disadvantaged. Participants had a mean age of 59, reflective of the advanced heart failure practice. It was racially and ethnically diverse, including 20% of people who completed the application in Spanish. Overall, patients had a relatively low technology experience, and almost half had adequate health literacy. The sample was very symptomatic. Over 75% had NYHA class 3 or 4 with a high burden of other comorbid conditions. Here I'm going to show you a series of panels, each of which shows 3 symptoms. In this case, pain, anxiety, and depression. We choose to display these symptoms across gender, race, and financial status because they are indicators of psychosocial adversity. All the measures that are reported here are measured using PROMIS, which has a standardized mean of 50 as a population mean. These results confirm the association between demographic measures of psychosocial adversity on different types of psychological symptoms. Once again, here we are displaying fatigue, sleep impairment, and anger, and the same relationship holds true here, except that anger was associated with gender, race, and finances, but not New York Heart Association class, which is a measure of patients' physical symptoms and physical function. And these panels report patients' impairment with their cognition, social limitations, as well as limitations with physical function. And these panels, lower scores indicate more burden. And once again, we see the same association, strong association with psychosocial adversity. So overall, this work is ongoing. This is kind of a work in progress. But what we have, some of the early takeaways are that these tools can help to close the gap between the hospital and the home. They can support patient-provider communication about patient symptoms. These visualizations can impact patients' mental model of their symptoms and reinforce which symptoms to monitor, and that patient-reported outcomes need to be returned to patients and not just stored in databases in order for them to be clinically actionable. I'd just like to thank my current team members, including Lisa Grossman from Columbia University. She's doing an MD PhD in biomedical informatics. Megan Redding is a postdoctoral research fellow here at Weill Cornell Medicine, as well as Dawan Baik, who is a postdoc research fellow at Columbia University School of Nursing. Thank you, and I'd be happy to talk more about my research with anyone who's interested.